Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Dihydroergotamine. Its brand name is Migranal. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe dihydroergotamine. We'll then touch on examples of dosing and finish it off with side effects. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So dihydroergotamine is a 5-HT1D receptor agonist. It works by activating 5-HT1D receptors found in the intracranial blood vessel and other areas, resulting in vasoconstriction. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see this medication prescribed in the treatment of a migraine or for cluster headaches. With respect to contraindications or reasons we would not be able to prescribe dihydroergotamine, well, we wouldn't give this medication to a patient who has a migraine following vascular surgery. Nursing mothers with ischemic heart disease cannot use this medication, as well as pregnant patients with peripheral arterial disease. Patients who have sepsis in the setting of severe hepatic impairment would not use this medication. And finally, this medication will be contraindicated in patients who have uncontrolled hypertension or high blood pressure with severe renal or kidney impairment. Now for examples of dosing with Migranal or dihydroergotamine. So in the treatment of a migraine, using the injection, we would typically see 1 milligram intramuscularly or subcutaneously as a single dose. Then the patient would have the option to repeat the dose at 1 hour intervals to a total dose of 3 milligrams. So the maximum dose would be 3 milligrams per 24 hours and 6 milligrams per week. If they were using the nasal spray, we may see 1 spray or 0.5 milligrams intranasally in each nostril, followed by an additional dose in 15 minutes. So it would be a total dose after both doses of 2 milligrams. As with all medications, there are some side effects or adverse reactions that patients may experience while using dihydroergotamine. So we'll go over some of those here now. Some common side effects may include nausea, diarrhea, or a leg cramp. And some more serious side effects may be a myocardial infarction or heart attack, ischemic bowel disease, renal or kidney failure, as well as pulmonary fibrosis. Alright everybody, that's all we're going to talk about today with dihydroergotamine or Migranal. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.